You're lying in bed tonight, and your mind won't stop. You're thinking about the reading you got this morning. You're thinking about what your doctor said at your last appointment. And somewhere in the back of your mind, a quiet worry is sitting there. Is there anything I can actually do right now, in this moment, to bring it down? Something real, something that actually works. The answer is yes, and it starts with your very next breath. My name is Dr. Baylor Scott, and in the next 15 minutes, I'm going to walk you through 3 specific breathing techniques, done in a specific order, that activate the one nerve in your body that has a direct line to your blood pressure. No pills, no equipment, nothing to buy. Just your breath. And I want you to know right now that technique number 3 is the one I'm saving for last, because it's the most surprising thing I'm going to show you today. And my patients consistently tell me it's the one they can actually feel working from the very first night. So stay with me all the way through. But before we get into the techniques themselves, I need to take 60 seconds to show you something. Because once you understand why this works, you're going to use it for the rest of your life, and you're never going to look at your breathing the same way again. Most people think high blood pressure is purely a heart problem, and yes, your heart is involved. But the real control center, the thing that tells your heart how fast to beat and tells your blood vessels how tightly to squeeze, is your nervous system. Think of your nervous system like a light switch that has a dimmer on it. During the day, all the stress and noise and rushing and worrying pushes that dimmer all the way up to full bright. Your heart rate climbs. Your blood vessels tighten up like a clenched fist around a garden hose. And your blood pressure rises because your blood is being forced through vessels that have no room to give. Now, here is what nobody tells you. There is a nerve in your body called the vagus nerve. It runs all the way from your brainstem, down through your throat, through your chest, past your heart, and all the way into your gut. It is the longest nerve in your entire body, and it is your built-in dimmer switch. When you activate the vagus nerve, and slow, intentional breathing is one of the most powerful ways to do exactly that, it sends a direct signal to your heart to slow down. It sends a signal to your blood vessels to relax and widen, and your blood pressure drops. Not over weeks, not after months of practice. We are talking minutes. Here is the number I want you to hold on to. The average adult takes between 15 and 18 breaths every single minute. At that speed, your nervous system stays in that bright, activated, high-pressure state around the clock, even when you think you're resting. But researchers at the National Institutes of Health found that when you slow your breathing down to just 6 breaths per minute, 1 breath every 10 seconds, the vagus nerve kicks in, the dimmer comes down, and your blood pressure follows right along with it. That is exactly what these 3 techniques are designed to do. So let's get into them right now. Technique number 1. I call this one the foundation, and there is a very specific reason it comes first. Because before you can do any of the more advanced breathing methods, we have to fix the one mistake that almost every single person over 60 is making without even realizing it. And I want to show you whether you're making it right now. Place one hand flat on your chest, and place your other hand flat on your belly, right below your ribcage. Just breathe normally for a moment. Don't try to change anything yet. Just breathe the way you always breathe, and notice which hand is moving. If it's the hand on your chest, you are a chest breather, and chest breathing is shallow, it's fast, and it keeps your nervous system locked in that high-pressure fight-or-flight state all day and all night long, even when you think you're relaxing, lying on the couch, watching television, getting ready for sleep. If you're still chest breathing, your body doesn't know you're trying to relax, because the signal it's receiving from your breathing pattern is still saying, stay alert, stay ready, stay on guard. What we want instead is belly breathing, also called diaphragmatic breathing. Your diaphragm is that large dome-shaped muscle sitting just below your lungs, and when you breathe correctly, it drops downward, your belly pushes gently outward, and your lungs fill completely from the bottom up. Think of it like filling a glass of water. You always fill from the bottom. You don't pour water into the top of a glass and hope it reaches the bottom. Your lungs work the same way. Let's do this together right now. Both hands in position. Breathe in slowly through your nose, and as you do, push your belly out like you're inflating a slow balloon right behind your belly button. The hand on your chest should stay as still as possible. It's the belly hand that does the moving. In for 4 counts. 1, 2, 3, 4. Now out through your mouth, slow and controlled, for 6 counts. 1, 2, 3, 4, 5, 6. That ratio matters more than most people realize. 4 counts in, 6 counts out. The exhale is always longer than the inhale, because that extended exhale, that's what pulls the vagus nerve into the conversation. Every extra second on your exhale is a direct message to your nervous system that the threat is over, that it's safe to stand down, that the dimmer can start coming down. Do 4 more rounds with me just like that. In for 4, out for 6. Belly rises on the inhale, belly falls on the exhale. The hand on your chest stays quiet. Even after just 5 of those breaths, most people notice their shoulders drop slightly, their jaw unclenches. There's a kind of warmth that settles into the chest. That is your parasympathetic nervous system beginning to take over. That is the dimmer moving. Some of my patients have practiced this one technique alone, 5 minutes every night before bed, and seen their resting blood pressure drop by 8 to 12 points over the course of a single week. And we haven't even gotten to the powerful ones yet. Speaking of which, technique number 2 takes everything you just learned and adds something that works like a sleep switch for your nervous system. It involves a specific count that most people skip, and that's exactly the part that makes the whole thing work. Technique number 2, I call this one the sleep switch. This technique was developed by Dr. Andrew Weil at the University of Arizona, who studied ancient breathing traditions and found that this specific pattern, the ratio of 4, 7, and 8, was consistently effective at reducing the body's acute stress response and lowering heart rate in a measurable, reproducible way. And when your heart rate comes down and stays down through the night, your blood pressure follows.
Here is the pattern. You breathe in through your nose for 4 counts. You hold your breath at the top for 7 counts. And you breathe out through your mouth for 8 counts. And on that exhale, I want you to make a sound, a soft whoosh, like you're slowly blowing out a candle that's sitting on the other side of the room. Now, the question I always get is about the hold. Why hold? What is that doing? Here's what's happening. When you hold your breath at the top of a full inhale, you are giving your red blood cells extra time to absorb the oxygen from that breath before it moves on. Your body reads that rising oxygen saturation, and it sends a signal up to the nervous system. Everything is sufficient. Everything is okay. You can stand down. And that 8-count exhale, the long one, the whoosh, that is doing the heavy lifting on your vagus nerve. Every second of that extended exhale is a sustained, direct signal to your heart rate control center. Slow down, slow down, slow down. Let's do it together. Get comfortable. If you're already in bed tonight watching this, that is perfect. Stay exactly where you are. Close your eyes if you feel safe doing so. Breathe in through your nose. 1, 2, 3, 4. Hold. 1, 2, 3, 4, 5, 6, 7. And out through your mouth. Whoosh. 1, 2, 3, 4, 5, 6, 7, 8. Let's do that 3 more times. In for 4. Hold for 7, out for 8 with that gentle whoosh. 4 cycles is all you need. You do not need a special application on your phone. You do not need a guided meditation program or a subscription to anything. 4 cycles of 4, 7, 8, done right before you reach over and turn off your lamp, and your body will enter sleep in a fundamentally different state than most people ever experience. Instead of crashing into sleep still wound up from the day, heart slightly elevated, vessels slightly tightened, nervous system still half convinced there's something to worry about, you will slide into sleep in a full parasympathetic state, and your heart gets to rest properly, deeply, all night long. Research from Harvard Medical School has linked consistent nighttime heart rate reduction, which this technique reliably produces, with measurably lower blood pressure readings in the morning, not after months, after days. Now, I told you at the beginning that technique number 3 was the most surprising one. I told you my patients call it the one they can actually feel from the very first time. We are there now, and I want you to stay with me for this one, because what I'm about to tell you about your own sinuses is something most people have never heard, and once you hear it, you won't forget it. Technique number 3, the humming breath. And I'll be honest with you, when I first encountered the research behind this technique, I was skeptical, because it is so simple that it almost sounds like it shouldn't work, but the science stopped me cold. Inside your sinuses, those hollow spaces in your skull, behind your nose, your cheeks, your forehead, your body is constantly producing a gas called nitric oxide, and nitric oxide is one of the most powerful natural vasodilators that your body manufactures. A vasodilator is anything that causes your blood vessels to widen, to relax, to open up and let blood flow through freely without resistance. When your blood vessels are wide and relaxed, your heart doesn't have to push as hard to move blood through them, and your blood pressure drops. Now here is the part that changes everything. A study published in the American Journal of Respiratory and Critical Care Medicine found that humming, the simple, almost embarrassingly simple act of humming on your exhale, increases the production of nitric oxide in your sinuses by up to 15 times compared to silent breathing. 15 times. Because the vibration created by humming produces turbulent airflow through your sinus cavities, and that turbulence dramatically accelerates the release of nitric oxide into your airways, and from there into your bloodstream. Your sinuses are essentially a nitric oxide factory that most people never turn on, and humming is the switch. Here is how you do it. Close your mouth. Take a full, deep belly breath in through your nose, just like we practiced in Technique 1. And then on the exhale, instead of letting the breath out silently, you hum. A low, steady, continuous hum. Lips lightly together, teeth just slightly apart. You should feel the vibration in your lips. You should feel it in your cheeks. You should feel it across the bridge of your nose and up into your forehead. That vibration is the factory running. That is nitric oxide being produced and released in real time.
Let's do it right now. Breathe in through your nose. Long, slow, full belly breath, and out. Hold that hum for the full length of your exhale. Nice and low, nice and steady. Feel where the vibration is in your face. Here is something specific I want you to try during this one. Place 2 fingers gently on either side of your nose, right where the nose meets the cheek. And hum again. You will feel the vibration directly under your fingertips. Several of my patients have told me that is the exact moment something clicks for them, because they can feel it with their own hands. They can feel the biology happening. Do 6 to 8 rounds. That is less than 3 minutes of humming. 3 minutes, and you are flooding your cardiovascular system with a natural compound that your own body has always been capable of producing. A compound that opens your blood vessels, reduces the resistance your heart works against, and brings your pressure down in a way that is completely natural, completely free, and available to you every single night for the rest of your life. Now let me put all 3 of these together for you, because the real power is in the sequence. Done in order, these 3 techniques build on each other in a way that compounds their effect. You are in bed, the lamp is still on, you're propped up just slightly, comfortable, relaxed. You start with belly breathing. 2 minutes, 5 slow cycles, in for 4 and out for 6. This is you resetting your baseline. This is you signaling to your nervous system that the day is finished, that the dimmer can start moving. After those 2 minutes, you move into 4-7-8. 4 complete cycles of in for 4, hold for 7, out for 8 with the whoosh. This is where your heart rate genuinely begins to slow. This is where you will feel your jaw unclench and your shoulders fall, and a kind of heaviness settle into your limbs. That is your body preparing for real, restorative sleep. And then you finish with the humming breath. 6 to 8 rounds. Fingers on your nose if you want to feel it. Low, steady hum on every exhale. This is where the nitric oxide flows. This is where your blood vessels receive the final signal to open up and release the pressure they've been holding all day. 5 minutes. Start to finish, the whole sequence is 5 minutes. And then you turn off the lamp, you settle into your pillow, and you let your body do the rest of the work. I do want to be straightforward with you, the way a good doctor always should be. These techniques are not a replacement for medication your doctor has prescribed. Do not stop any medication without having that conversation with your physician first. What these techniques will do is work alongside your treatment. They will give your cardiovascular system the nightly reset it has been missing. And for many people, with consistent practice, this kind of intentional breathing before sleep has been associated with real, measurable reductions in both their top number and their bottom number. Patients come back to me and say their morning readings are better, their doctor is encouraged, and when I ask what changed, the answer is almost always that they started treating their nighttime with the same seriousness they give their medication. They started treating it like a medical event, a deliberate, structured wind-down that gives the body the tools it needs to take care of itself. You have those tools now. You have always had them. They were built into you. You just needed someone to show you how to use them. If you made it all the way here tonight, if you tried these techniques, if you felt something shift in your chest or your shoulders or the back of your mind, scroll down and leave me a comment that says calm pressure. Just those 2 words. I read every single one, and it lets me know you're putting this to work tonight. And if this helped you, please think about someone you love who is lying awake right now with the same worry you had when you clicked on this video. Share it with them, because the solution is this close for them too. It starts with their very next breath. Now, breathing brings your pressure down in the moment, but if you want to keep it low all day long, you need to know which 5 foods are quietly raising it every single morning at your breakfast table. Some of them are foods you've been told are healthy. Click the video right here. I think it's going to surprise you, and I'll see you there.